Clinical depression. Some people experience deep depression or anhedonia, which is a loss of the capacity to experience pleasure, often for no apparent reason. Their depression can be so extreme that it can impair cognition and makes it almost impossible for them to meet the essential requirement of their daily lives, to keep a job, to eat, or to maintain social contacts and personal hygiene. Sleep disturbances and thoughts of suicide are common. When this condition lasts for 2 weeks or longer, these people are said to be suffering from a clinical depression. It is also known as major depressive disorder. Depression is often divided into two categories. First, reactive depression. When depression is triggered by an obvious negative experience such as death of a friend or loss of a job, it is called reactive depression. And the second is endogenous depression. When depression is triggered by no apparent cause, when there is no direct or obvious cause of the depression, then it is called endogenous depression. These are the categories of depression. Clinical depressions attack children, adolescent, and adult. In adult, clinical depression is often comorbid. The tendency for two health conditions to occur together in the same individual with one or more health conditions, for example, anxiety disorders, coronary heart disease, and diabetes. There are two subtypes of major depressive disorders whose cause is more apparent because of the timing of the episode. One is seasonal affective disorder, also called SAD, in which episode of depression and lethargy typically recur during particular seasons, usually during the winter months. Some evidence suggests that the episodes are triggered by the reduction in sunlight. One is that the incidence of the disorder is higher in Alaska than in Florida, where the winter days are longer and brighter. The other is that light therapy, for example, exposure to 15 to 30 minutes of a very bright light each morning, is often effective in reducing the symptoms of SAD. The second subtype of major depressive disorder with an obvious cause is peripartum depression, the intense, sustained depression experienced by some women during pregnancy, after they give birth, or both.